Hi, I'm Tobias Atkins, CEO of Atkins Health, and I'm super pumped to be joined here today by our resident women's health guru, exercise physiologist, and mother of 16-month-old Nicole Harnett.
Hello.
We are super excited today to be able to share with you some incredible wisdom, experiences, and journeys of some extraordinary women that we've had the opportunity of interviewing over the past few weeks.
From entrepreneurs to health professionals to business women to mothers, each of these has an inspirational story and a journey of wealth of knowledge which we hope you can take away and become a superwoman within you.
No matter where you are in life, age or demographic, we hope that this podcast shows you that you are not alone. No matter what you encounter and how hard womanhood becomes or is for you, we hope that this shows you that there is a way forward that is both prosperous, exciting, and fulfilling.
So sit tight, tune in, and be taken through our speakers' life lessons and journeys, and hopefully, if you're open to it, become a better version of you.
So today's guest is nothing short of incredible. Mother of two, practicing physiotherapist, wife, business owner, and because that simply isn't enough, she spends her spare time as a professional dancer in her own dance school in our very own backyard in Burleigh Heads. Previously graduating from Western Sydney University with a Bachelor of Science in Sports and Exercise, and continuing on to do her Masters of Physiotherapy in Sydney University, our guest started Bump Fitness Physiotherapy in 2015. Bump Fitness Physiotherapy is led by our very own guest today, Phoebe Armfield. Their vision is to support, educate, and empower women. Phoebe, thank you so much for joining us today.
You're welcome. Thank you for having me. That was a lovely intro.
Oh, no worries at all. So because I love to ask all the personal questions, I want to know how the hell you do all of that in one working week. That sounds incredible.
Yeah, look, it's a bit of a balance. Some weeks are better than others. You just make it work. And lots of coffee. That helps.
Yeah, I bet. I think it's a woman's trait. I'm like one thing at a time. That's it. That's all I can deal with. So, pretty inspiring.
It's a bit of chaos, but it works.
No, that's awesome. And I must admit, I a little secret about myself. I am a bit of a groover. Not very good at all by any means, but I'm very keen to hear what kind of dance do you actually do. Like, what's your dance studio?
At the moment, pole dancing.
Yeah, that's awesome.
Yeah, I've got a background in ballet, so I was always a ballet dancer. And then when I was 23 or something, I sort of found pole dancing and just started a few classes a week. And then fast forward of 15 years, I've got a studio with one of my friends. So it's sort of a side hustle, I guess.
Nice.
Hobby business that takes up a lot of time.
I can only.
But a lot of fun.
That's epic. Yeah, I've seen a few of my friends actually do it for fitness, and I swear it's more like gymnastics than it is like dance. I mean, obviously it's dancing, but like it's pretty crazy the amount of stuff that you guys have to do.
Oh, it can be insane. Yeah.
Cool. Well, I did promise Nicole that I wouldn't sit here and yarn about all the random personal stuff. So we'll get stuck into today's session if that's cool with you.
So we know that there's several changes for the body that happen both during and post-pregnancy. What are the top challenges that you see with women both pre, during and post-pregnancy?
There's sort of a variety of things that women can experience, during and after. The main ones that people come to see me with are back pain, low back pain, and pelvic pain. And then urinary incontinence. They're probably the top three that I see. But, pregnancy brings a whole host of challenges that you don't have in your non-pregnant life. Yeah. Hypertension and preeclampsia and issues with the placenta. So, yeah.
So during our pregnancies, we do have a lot of examination and checks during the pregnancy. But can you explain to people why it's so important to have checks postnatal?
Yes. So during pregnancy, it's very structured in the checks that you have with your GP or obstetrician. They kind of just go off a cookie cutter, blood test here but then once you go postnatal, you have a 6-week check and you kind of, that's it. And the 6-week check is kind of more focused on the baby. So the mother sort of gets are you okay? And that's almost about it. And that's not to say that the GPs or obstetricians are doing poorly. It's just they have to do a lot in that 6-week check. So it's really important to also, if you're having any issues, go and see someone. So obviously I'm a women's health physio, so I'm a little bit biased. So I think you should definitely come and see a women's health physio. Especially if you want to return to some sort of exercise or you're having some sort of physical issues. A lot of people don't understand that women's health physios also help to treat bladder and bowel issues. The first point of call is after you've had your 6-week check with your GP or obstetrician, I would go and see a women's health physio just to check yourself over physically. And they can also do an internal examination and check your bladder and your bowels and do a screening for all your functions just to make sure everything's going back to normal.
So your concentration seems to be more sort of pelvic floor. So can you tell the audience a bit more about the importance of being aware of your pelvic floor and what the sort of importance is to addressing that or retraining that, if that's the case?
Yeah. So the pelvic floor has sort of essentially 2 functions. They open and close the door, I guess, for your bladder and bowel functions. So they help with those. And then they also help to support the internal structures. So they sort of sling up your bladder and your bowels and your uterus and everything that sits in your pelvis. So it creates sort of an internal architecture, I guess.
Okay.
Having them strong and functional helps the bladder and bowel functions, but it also helps to keep everything where it should be.
That was my next question, wanting to ask what sort of health conditions can be helped by improving the function of the pelvic floor, but you've kind of nailed that in a nutshell.
I got a quick question in regards to that. Obviously, I am not a woman, just for the audience to know that. So this is kind of a little bit out of my realm. I've obviously helped women before, but it's definitely not my specialty area. I can kind of imagine, though, that this topic, unless kind of brought to their attention, would be really kind of challenging or difficult maybe for a woman to seek help for, or even like I'm kind of talking about more that psychological kind of component that would come with these kind of post-pregnancy bodily things that kind of occur, right?
You're also including an internal examination, like throughout your pregnancy, you get poked and prodded a lot, let alone the actual process of giving birth as well, then to add another level of, I guess, examination on top of that. Do you see any kind of people being, I think, withheld from wanting to do that?
Yeah, definitely. I've definitely seen a shift in people talking about it and normalising it, and well, not normalising it, but letting it know that it's common and it's treatable. I see a lot of older women who didn't get that experience where they just had to deal with it, basically.
Sure.
So I find the women now are a little bit more forthcoming. But having said that, especially if you have any trauma with birth or any depression or anxiety, some people are not as willing to come forward and seek help for their treatment, for their issues.
Does it matter what kind of delivery they had?
No.
It affects everyone.
Affects everyone differently. It doesn't matter what kind of pregnancy you had or delivery you have. You can have different types of symptoms, even if you have bigger babies or small babies. So some things obviously make it worse and predispose you to some conditions. But seeking some assessment after you have your baby is always a good option, just so, because some people aren't aware that they have, say, a prolapse. They might not understand what a prolapse is. It's not painful. It's just like a feeling.